COVID-19 and the responses taken to curb its transmission can interact with the symptoms of PTSD and make them feel worse. This video is going to briefly look at what the symptoms of PTSD are and how COVID-19 may interact with them. Post-traumatic stress disorder can happen after we survive a trauma. The symptoms people experience can make them fear that something's really wrong with them. Yet PTSD is a normal reaction to an abnormal event. The symptoms are a sign that our mind is doing its very best to deal with the terrible events we have survived. Normally, our memories are processed by the mind. They are given a timestamp to say it happened in the past and are filed away to fit in with our other memories that make up our life story. During a traumatic event, our brain doesn't process the memory in a normal way because we are experiencing extreme fear. Fear stops the memory from being stored properly in a way that tells our brain this happened to us in the past, which contributes to PTSD symptoms. This means that bits of the memory can pop into our mind when we are not expecting it and don't want them to. We call this PTSD symptom intrusions. Sometimes it can feel like the memory's happening again, right now in the present day. It may feel like the memory is being played, almost like a cinema screen, right in front of your eyes. We call this a flashback. These can include re-experiencing sights, sounds, smells, emotions, and pain from the traumatic event. Sometimes the memories come back to us as nightmares. These are all called re-experiencing or reliving symptoms. Flashbacks and nightmares are brought on by triggers, which are reminders of the traumatic event. Triggers are strong senses that are similar to the sensations that were present during the event. These can be external triggers, a similar smell, sound, sight, touch, or taste. They could also be internal triggers, like a similar sensation, for example, a fast-beating heart, or an emotion like anxiety or anger, similar to how we felt at the time. When a trigger is present, it can cause our body to react like it did during the traumatic event. Another symptom of PTSD is hyperarousal. This is when our body's responses are heightened after the trauma. For example, we may find ourselves easy to startle, feeling on edge or irritable, find it difficult to sleep, or feel really unsafe. After surviving a traumatic event, we also may experience negative beliefs and mood. We may experience negative beliefs about ourselves, like, I am bad, or blaming ourselves. We may experience negative beliefs about others, like other people are bad or dangerous, or beliefs about the world in general as a dangerous place. We may find ourselves feeling anxiety, fear, guilt, shame, finding less pleasure in our activities that we used to enjoy. An understandable and common way to cope with these difficult feelings, memories, and thoughts is through avoidance. This may be avoiding certain places or people or any reminders of the traumatic event. It may be avoiding our thoughts, trying to push them out of our mind. It may be trying to avoid feelings and painful sensations. We might do that through using alcohol, drugs, or engaging in risky behaviour. Whilst this is intended to help survive the feelings, through no fault of our own, avoiding thinking about the past can make it come into our mind more often. And so all of these symptoms can leave us feeling a constant, current sense of threat. The COVID-19 response can interact with these different symptoms of PTSD and make them feel worse. It may act as a trigger by resembling parts of our traumatic event. For example, the important measures asking people to stay indoors may trigger memories of coercive control during domestic violence. Having to self-isolate, especially in a small living space, may trigger memories if our traumatic event involved being held hostage or as a prisoner of war. It may reinforce beliefs that the world is a dangerous place. It may increase already difficult negative emotions. The uncertainty of the current situation can increase anxiety. And in turn, our body may even be on higher alert. We may find an urge to numb or avoid these difficult feelings. It is normal and understandable for the change and uncertainty of the current situation to contribute to the feeling of current threat that is part of PTSD. It is normal during this time for intrusions, flashbacks, or nightmares to feel worse. It is not a sign of you not coping. It is a sign to turn to and use the tools and techniques you may already have learned to manage these symptoms, to ground yourself and help yourself to feel safe. Or if you haven't heard of these grounding tools or are interested in hearing some new ones, we've developed some guidances that can walk you through them that are available on our website.